right, I'm Eric Sittler. I'm the law director. Due to this being a newly formed committee, I'm going to start the agenda. We'll call it to order. Mr. Hyde, could you do the invocation, please?
I will be glad to. Heavenly Father, we thank you for your many, many blessings to us. And we just pray, Lord, that as we assembled here today to do business for this great county, that you will give us wisdom and guidance, that the things that we do will be in the best interest of the people. We pray these things in thy name. Amen.
Thank you. And has everybody had a chance to review the agenda?
I need to add an item to the agenda.
Okay.
So under report of the committee chairman, we're going to add report of the law director. I motion.
Second.
All right. Those in favor?
Aye.
Opposed? All right, it's on there. Any other additions? Oh, is this not on there? And what do you-
This is a work comp payments.
Oh, okay.
And the
And
liability
then I'm
payments.
making a ask for an addition of, I've got November 6th and November 27th liability claims committee minutes that we'll need to approve with the other minutes. And that is a board that was absorbed by this new self-insurance board, so we'll need to get those voted on. And what was this one again?
Work comp payments.
Oh, and then the work comp payment list, if we can add those as, I guess, well, minutes will go under F, 1F, and then we'll just put this under report of law director, the second. So if we could get a motion for that.
So moved.
Second.
All right, those in favor?
Aye.
Opposed? Approved. Anybody from the public wish to be recognized? All right. Nat?
I'm sorry.
Yes.
Did we approve the agenda, or we just approved to put the item
Oh,
on?
I am so sorry. Yes, we need to approve the agenda. Can I get a motion for that, please?
So moved.
Second.
Approve, those in favor?
Aye.
Opposed? All right, it's approved. Now we're on to the election of the chairman. Any nominations?
I would like to nominate Terry Boyd.
I'd be happy to do that.
All right, let's go ahead and make a vote on it. Those in favor?
Aye.
Opposed? All right, we have a chairman. I will now turn this over to the chairman.
I'll nominate Merrill Hyde, vice chairman.
I decline, and I nominate Bob because I've got one too many committees I'm running around on now, so.
Okay.
So that leaves it up to me. Bob, I'd love for you to be my vice chair.
Okay.
Can I get a second, Mr. Hyde?
Second.
I guess we're all in favor. That passes. Approval of the minutes. We have 3 sets of approval. A motion to group and approve.
So moved.
So all in favor? Aye. Minutes approved. So the next item on the list is the report of the committee chairman. I think we're all familiar that we've combined the 2 boards together now, so we're going to function as a group, as the agenda reflects. If anybody has any questions as we go along, it looks pretty clear how it's laid out.
One thing that I'm not clear on yet, are we going, the insurance for the buildings, is that going to be part of this board now too?
So you can speak
Okay.
to that.
Yes,
The
we
buildings, yes.
have, we have been actually serving both boards all along
Okay, I just
independently.
want to make sure.
And I think that maybe what Commissioner Brown is wanting to know is, like, we would like to know if all of our buildings have insurance or how it works. So when it comes time for your
Okay.
presentation, if you could drop into that.
Sure.
And then at some point, I think that we're going to also wonder if we have coverage on all our buildings. And we'll be like asking you, if you could report out to us how you have a list and how we might get that, that would be helpful
Right,
during.
I'll comment on process, specific questions I'll have to get with the director of that department and get those reports for you. I'm confident that the answers are correct, are yes, but I don't want to speak out of turn with
All
that.
right.
Since this is kind of a new thing, I want to make sure
Yes.
we get that the way we would like it presented.
All right.
You have a list of all the buildings.
Oh, we have a-
That's a step in the right direction
Yeah,
that we
so
have not
we can
had.
address
We
that.
have an
That I
intimate
know.
list. of
Okay.
all
Very
your-
good.
Yeah,
So
that's good.
if you could just
And
speak
it's
on it.
updated every-
Yeah.
It's updated every year.
Yeah, and if you could speak on it during your
That's right.
report.
Yes.
And then we can follow up afterwards to get the documents and stuff.
And just for future, if I may, Kim handles quite a bit of that, so a lot of this stuff can be abbreviated and better read if you make your request through her or myself, and we can get in contact with them and streamline this process for you if it
Perfect.
helps any.
Great.
And all the buildings are insured. We can actually have a right off.
Yes.
We know that one.
Did we approve the minutes?
Yes,
Yeah, we did.
yes, we did. We'll get back to that one after the meeting. So that's the end of the chairman's report. We move on to the report of the consultant.
Did you say, I'm sandwiched in there.
Oh, I'm sorry, Mr. Law Director. Thank you.
And I've got my trusty Kim White by my side. She knows more about this than me. I'm just the monkey they dress up and send to court. So if you'll give them an update on this, please.
Yeah, the attachments that I've given everybody, the work comp payments, we just need approval, or if you have any questions on any of those, just,
This is the first time I've seen them.
Okay.
So if you could just tell me briefly what I see.
what you see is, I've got November and December, which are the two that have not been approved by a committee. They are broken down into the departments that have injuries and payments that are made from each of those three departments. Board of Education, we still have some of Board of Education's claims that we're cleaning up. Some of them are gonna be lifetime. Because-
Understand.
Yeah, and then the county general and the highway department. And they're just broken out into three different categories, and that's what we paid in the month of November and December for those departments for injuries, or bills that came through for those three departments.
And so this board is just providing oversight by
Yes.
signing off that we saw them.
Yes.
That's all?
Yes.
Okay. Thank you.
The education are just the ones that were here before they.
Understand.
And I do have to collect those payment schedules.
Mhm.
I shred them after the meeting, so we don't have those floating around.
Not because the reports.
I've taken the names off, so it's just got the department
So it
and,
shouldn't be an issue if they didn't have.
No,
Yeah.
only what she was talking about shredding.
no diagnoses, no names are on
No
there.
HIPAA related stuff. And I think that concludes anything unless anybody has any questions.
I'm sorry, thank you.
They need to be approved. Yes. Yeah.
So, can I get a motion to approve the claims?
So moved.
All in favor? Aye. And approval passes. So, we'll move on to the report of the consultant.
All right, we'll start with health, and then we can do buildings. So this is a report that I put together every month. I want to go back over it because not everybody's been part of this meeting in the past. So, I'll break it down so everyone knows what they're looking at. Here you go, sir.
Thank you.
Absolutely. So this is just for December. I do, again, do this every single month. We look at money coming in and money going out, just to simplify it down to just the black and white. So at the top left-hand section, there's the numbers, and there's also a picture to kind of go along with it because everyone's kind of different in how they interpret information. So I do want to point out, yeah, you see a red box. That means there's a negative number for that month. I just draw attention to the fact that there's negative, but do not worry. Because when you see a red box like that, look below it, and that shows you the year to date. Every month ebbs and flows. That's just how health insurance works. Some months you're gonna have more going out, bigger claims, surgeries, things like that are happening. So yes, for the month it looks a little negative. It's a negative $101,000. However, for the month you're still positive $1 million. Okay, so that's important to note. That's why we look at month, and then we also look year to date. So these are also always done kind of a month later. Obviously, claims have to come in for December for us to do a December report. So when we don't meet, they will come to you electronically. So through email, through Amy. Then the summary for dental, because that's also self-funded, that's still at a positive. It's running basically how dental we expect it. That's a very, it ebbs and flows a whole lot less than health. So then on the bottom half of the report, this is where I really like to pay attention. So the left-hand column, or the left-hand section, is our large losses. We track these. I usually start looking at above $100,000. So one important note, just because not everyone was on this part of the trust before, we do have stop loss through ourselves. You have stop loss through yourselves. We don't pay an insurance company for a stop loss policy. The last time you did that, your stop loss policy was at $500,000, and you were paying out funds for this policy you were never reimbursed for. And so after a time, the trust voted to pay yourselves. So that is actually what this number is underneath all these large stop losses. So there's the running county stop loss fund, and then prior years. So that just looks at, since you've been doing this, you all have $843,708,000 set aside for stop loss in case you ever do have a claim over $500,000. Since we've been doing this, it's happened one time. And it was the year where you can see the peak. We had a lot of claims that year. That was what we in insurance consulting would call your bad year. There's usually one every 3 years or so, and that was what it was. What you did at that time, David had me remove the amount over $500,000. We took it out of that fund because it's stop loss, so we're going to treat it that way. But since then we haven't had another one. But I do keep an eye every single month on who is close to 500, and you can tell here even your highest large loss claim is not even halfway through the plan year, Bob.
You didn't mention that withdrawal was only $30,000.
Okay, yes, it was a $30,000. That was the highest claim you've had in multiple years. It is always possible, though. We are usually very conservative. It could happen. You could have a baby that ends up in the NICU that is $1 million. These are a reality of 2024 and living in Nashville. Things do happen. Usually, it is going to be a NICU claim or a really, really expensive medication. You might hear of genetic, therapeutic drugs, things like that are coming to market that can be very expensive. But everything is tracking as expected per other plans out. And again, you are still comparing it to that, what was that, 21-22 year, which was really a COVID catch-up year. That year was pretty bad. You're still not anywhere near there. So the column that I would suggest anyone pay attention to is this little chart here, the PEPM. So yes, Sumner County, as far as how many employees and covered lives you have, it changes. It has changed since, if you compared it to 1995, whatever, you have a lot more employees. So PEPM, that's why I think it's more important than your large number. To me, if we can keep your PEPM flat, that's what I'm looking for. So again, 21-22 is that one that kind of like peaks up really, really high there. But you can see compared to last year, you're basically flat. You are not too far off from 13-14. And I will tell you, there are not many plans that we can say that about. So you all are doing quite well in controlling your costs without taking away benefits. So are there any questions about this report? And also, if you have questions and we don't have a meeting, please feel free to filter them through Amy, through David, Jessica, whatever. I would love to answer anything you have. Yes, sir.
Does this have the Board of Educational?
No.
I saw down here at the bottom where you have the asterisk, classified employees were removed, and usually that's...
Right. So that's when the schools broke off from this trust. So no, this does not, we do not consult for the schools. Love the opportunity, but we don't. So no, they're not included.
So I just want to clarify.
Mhm.
The running county stop loss fund
Yes, ma'am.
is just under $1 million. That's what we have in the bank, or
Yes.
reserved. If we have that $1 million hit, then it'll take it out. But that's why we're self-insured.
Correct. And the chance of it is quite low, but again, I will tell you, it's always possible. But yes, it would wipe that out, as well as what's not included here, and that's probably what you want to point out, is there is no reserve on my report. If you want to know how much you all have in reserves, he's your guy.
I know.
I'll talk to
I know where it is.
Yeah, that's where it would
I've seen-
pull.
I know the reserve.
Yep.
How much was the large stopgap insurance that we're, how much did it
So
cost us?
let me tell you what every year I still ask Blue Cross, quote me what it would cost for Sumner County to have a $500,000 stop loss policy. And so that we get updated every single year, and I tell David, hey, this is what they quoted, so I'm gonna start using this as our number for tracking, so this is how much we need to set aside.
That's how much we set aside.
I cannot tell you off the top of my head how much it is every month. 30,000?
I think, that sounds
About right.
close,
$30,000 or so every month. I'd have to check though, so don't quote me on that number. But that's about how much you were paying out every month and
Right,
getting nothing back.
right, I
A
understand.
couple of things to help is you've only been off of stop loss a couple of years and you've already put 960,000 back. It didn't cover until after 500,000, and then I think the cap was it $1 million?
It's usually, yeah.
$1 million, so you gotta
I
think,
think.
it covers you over 500,000, has a cap of $1 million, you've almost got $1 million set back now. So it was the right decision to get rid of that. Unless something changes, it would be the right decision not to ever bring it back at this point. And Bob, I think.
I'm just gonna comment, that was not an arbitrary decision, that was based on a 10-year actual study of what you paid, what claims were, and how it tracked. And I might put a caveat on that. What has allowed the county to do this, because you're not gonna find this very often with employers, that they could do this. The first thing I put on that list is your clinics and your control of chronic claims, or identifying chronic claims. I think they would agree that is an important thing. We see a lot of groups, and almost all groups, if you look at their total claims paid, about 70% of those claims are what are classified chronic claims. Diabetes, heart, all those things that cause us to have bad problems. And if we can identify those early, manage them, and give the proper medication, and the patient take control of their health, that's what allows you to keep your claims down. Claims are claims are claims are claims. I don't care what you pay an insurance company, some of that, a good portion of that is claims. So that's what you control, not what the insurance company gets, although occasionally that and brokers and stuff is enormous. But that aside, you can't control that. If you control that, you're controlling about 30% of your costs. So our concept here was to, let's control 70% of our cost. And your employees need a pat on the back and a thank you for participating and taking control of their health. That's how this works and why the county is sitting here. I would challenge you to find 3 or 4 companies in the state of Tennessee that can tell you they're paying now what they paid several years ago.
The other issue on reinsurance is if you do have a bad claim, the following year when they quote you, they'll do what's called a laser.
Yep.
And they'll remove that claim and give it back to you. So they're only gonna cover you what's over $500,000 for 1 year for that fee. The next year, they're gonna laser and give it back to you, so
Or spread
it's
the
gonna be
premium.
pretty, well, almost always
Raise
laser too.
that,
Yeah.
yeah.
I
They almost
both.
always
They'll do
laser
both.
both.
I like it, I just wanted to.
No, that's
know what we
absolutely,
were-
I love.
Almost impossible
That's
to
great.
come out ahead
Yeah.
on that reinsurance. It would be near, well, actually, I think it is impossible to come out ahead.
Probably not.
I can't think of a way that you
No,
can come out
so
ahead.
the way
on
I
that.
explain stop loss companies to most folks is that they are like Vegas, the house will win.
Yes,
They
I
will always
understand,
win, so
I'm
yeah.
good.
Good.
I just
Okay,
wanted to
great.
know how much we were offsetting from
Yeah.
what it would have cost.
Yeah.
This
Okay.
chart down here, is this
Yes.
December, is this all 12 months? Is this,
It's
what- or
the
is
6
this,
months.
is this the 6 months?
6
Okay.
months because we
I
follow your
understand.
actual plan year, so July to June. So,
Okay,
yeah,
thank you.
absolutely. Any other questions?
I've got one.
Yes, sir.
The classified employees that were removed, so they were included in this graph line up to 2015?
Correct.
Okay, so that's why we start to get the little bit.
Well, sort of. There's an average cost, though, that's part of the effect, but we also, part of it's our wellness plan. We keep changing it. So the wellness plan, actually, when they changed some of it, actually decreased cost also around,
Mhm.
it was around about that period.
What was
Yeah.
that one that was?
Well, I think 16-17 is when you actually put the full wellness plan in, so that was after, I think, the last 5 folks
Right,
left.
which is where the big.
And that's where the
big.
bigger dip happened,
Right,
when
so
you were
you-
below $800 PEPM, which is
So, right,
absolutely
so when you,
unheard of.
when you took the schools out, our actual average cost per plan went down, but then we initiated the wellness plan, it went down. Or we actually upped the wellness plan more, it went down
Yeah.
lower.
And let me clarify, PEPM is, I just use your employee count, so this includes families of who knows how many, older couples who might have more medical, whatever, it's just employee count.
Just one added thing that's important in this graph. As this graph moves along, industry-wide, health claims, in particular pharmacy, has gone through the roof. So this is what is also controlling that and suppressing that for your group. So it's a double hit on the industry from you guys. So it's just important to note that. This is not all because your claims went up. Yes, they went up, but they went up above what they were going up because just the cost of all that stuff is going through the sky.
What this isn't showing you is that by and large prescriptions, drugs are becoming a larger percentage at a very alarming rate every year on this plan to every plan.
Correct.
So your large claims are an issue, but the one that's really out of control is your prescription pharmacy. There was a plan to go back and actually separate it out and maybe control this cost, but the state legislators went in and approved a law for small pharmacies that put a stop to you guys controlling that cost. So right now, by and large, the employers need to urge their state legislators to remove the statutes that keep you from controlling pharmacy costs right now.
Yeah.
Is that
Yeah.
something you can give us those bill numbers?
Yes.
But Bob can get it for us.
Yep.
He probably knows
If you
it
could
right
give
off.
us the bill numbers so that we can educate our other commissioners on
Sure.
how to
Absolutely.
talk to our legislators.
Absolutely. And for the new folks that's, not new folks, but the folks who've come onto this board, we have met with Leader Johnson,
Mhm.
and he actually was against the bill, but his party voted it in. So there was a bunch of conflict. So we went down and met with him personally. He gave us an audience, Brittany and I, and we discussed this with him. So I think we would get some support, but politically, he's not in a position to push that until local
But she's gonna discuss
politics
it.
start coming in and saying, this is wrong. And I can summarize that bill real quick for you. I'm gonna get you a copy. But it was passed to help the local pharmacist. Because people were pricing, whether they were pricing drugs, it was kind of pushing purchasers to the chains, and the local owned pharmacies were suffering from that.
They also were not, they were paying more for the medication than they could charge it. They were losing money.
Right.
Which is obviously an issue.
But what it actually did was to support the PBMs, the people out there that are causing this problem. It just opened the doors wide open for them. So, which means groups like yours suffer. Yes, we want to support the local business, and we could do that. So what we've done with another county and NES and another school board, school district, before this bill passed, we worked and come up with a single pill pricing on drugs, and it was working. And I think that was another reason they wanted this thing gone, because the pharmacy industry noticed, we don't want this trend to continue, because it's not in our best interest. So they just ran into a brick wall. So we've done everything we can or continue to do to try to get that obstacle out of the way. And if we can, the county can participate as well.
So, and
control
if I
costs.
can ask you, when you were down at the legislation, our state senator, Hale, he's a pharmacist. Did you speak with him?
I actually think he might be one of the sponsors of the bill.
Yeah,
Let me
I-
check on that, but I feel like he might be.
Right.
So what we found out even from Senator Johnson was that really it's a lot of small, so everyone has lobbyists, of course. Small pharmacy, everyone's part of a lobby. And that has pushed. And the political look is support small business, which, yeah, of course, everyone wants to support small business. But what happened, and this, you all know that this is what happens. They passed a bill that was trying to attack 10 things, just ran all in one. You cannot make changes that way because it affects things that it really shouldn't be affecting. And so we're missing the point. Pharmacy has to be kind of peeled apart. My goal is that eventually we pay what things actually cost instead of this like just random number. We're going to charge you $20,000 a month for this medication. Where did you come up with that like, what is that? And why does that person pay $10,000? Why can this person have a coupon that makes it $0? That's the issue that we're dealing with, and they try to make it all in one bill to help support the small pharmacy, which I get. But yes, that's the issue with. I'll check on the sponsor because the sponsors are always on the bill, so we can look and see.
Thank you.
But I do think that.
Thank you.
Yes.
And then before we go to one-to-one, can we just briefly understand how you tell us about our business, our building insurance and how that works, the reinsurance, and if you could just give us a brief look into how that works.
Well, and I'll just give one sentence here. I think everyone understands that you are self-insured on your work comp and your liability and so forth. So that's all processed through the department to take care of those. And there's funding and reserves and all of that, just like this health plan, okay? Property is not something you really want to self-fund. It's like we've seen tornadoes go through. I mean, it can, if it hits 2 or 3 schools, it's a huge claim because we're seeing schools now that the square foot price on schools is just phenomenal. You all know that. So that brings us to the property part of your question. First of all, as far as your database of your property, our staff has been at every location you have. They have been in every building. They have measured, taken pictures of. They know what the walls are, the ceilings are, the square footage, the HVAC systems. We have to gather all of that data on every building to process it through an industry-leading software that we lease to feed that data in, and then by zip code, that gives us back and says, based on the information you put in, here's what this building should be insured for today. And I want to emphasize, not sell it. The sale price of a location and to build it back today are 2 different animals. A lot of people say, well, we'll just go get an appraisal. You don't want an appraisal. You're not selling the school. You're going to replace it if something happens to it. So this software is designed specifically to come up with insurance values, reinsurance or insurance values. And so then at that point, we have data, and the insurance companies that bid on your love this because we're not just saying, well, we think it's $100 million. We think, we don't know, really sure. Well, we send them all these reports and say, no, here's what we want to insure for and here's why. And so that's how we come up with what you all go out to the market and say, here's what we want. The other thing we do is that we write and edit and work with Kim to develop the RFP that's sent out. And then we handle that. We answer questions, handle the process. Comes back to purchasing here. They open the RFPs in a public bid opening, and then they give a copy of that to us. We take it back to the office, go through it, develop reports, call references, all the things that need to be done, and then come back with an executive report to you that says, based on what we see and what we've discovered, here's what we think is the best thing for the county to do. And then once the county makes a decision, then we get with the losers, we get with the winner, we make sure that we read contracts if it's for insurance, not for law. We're assuming that handles here on as far as that, but we want to make sure that the contracts are in your favor as far as insurance, how the claim will be paid, those kinds of things. And then we get the policies, we'll look at the policies and make sure you got what you were told you bought. And then we have copies of those electronically back for several years if we need to go back and check something and so forth. So that's kind of a thumbnail.
Oh, go ahead.
So this is all on developed property, it's not on any undeveloped property that the county may own,
You mean just like a piece of land?
just like a piece of land.
Correct, because you can insure that for property insurance.
We sent out a fixed asset listing to, I think it was Mr. Klein a while back from what we have booked.
Well, that's, again, one of the things that we've been trying to get is a list of all county-owned
doesn't-
properties.
Does not have,
It doesn't reconcile to other lists from other,
these ones we have on our financials based on what we could pull deeds and stuff on. So
So-
if there's property that's not in their name or it's changed recently we don't know about maybe
so we can
or
take that
something.
on after this meeting and discuss
Talking
it.
about like the floodplain property that we got down there where
I
Center
have-
Point.
Does it have a
Mountain
deed to
Creek
the county?
Come together.
So we can work on reconciling those pieces afterwards.
Probably if you find pieces of property that's not on that list that we sent, send us an email, because then we can research and see if the deed was missed or if it's actually identified in some weird way that wasn't picked up as a deed or we were never supplied. When they pick up property, it's supposed to be supplied by us and we actually go look for deeds and purchases. But
And that's the item I'd like to ask you is, I'm still trying to understand, my understanding is that our courthouse sat without insurance for a while. So I'm trying to understand where that breakdown happened and how you are notified and how we get things to make sure we do have insurance on it. So if somebody at this table can explain that to me.
Well, once we received that certificate of, it wasn't a certificate of occupancy, but once we received the information from the contractor that it was complete and that it needed to be added to our schedule, it got added to our schedule. It was added to our schedule effective October 16th of last year.
So I sat at this table at budget and the law director asked us to give him special permission to write a check for the next day because we hadn't paid.
No,
for
that was for the
insurance.
insurance premium. It took a few weeks for us to get the actual insurance premium, but it was active on our policy effective October 16th.
So that you knew about, I'm just trying to understand the process of putting a new building on. So it would have went through and you would have known it was coming and you would have had it out there to our providers or in the, because I understand from what you're describing is we have a bundle. Here's our bundle, give us an RFP bid. So we have a new building coming on.
that was where
And-
they signed the sheet that said that we were.
And it would have
responsible
came to you at some point for you to
It wasn't a
tell our
certificate of
provider, here's
completion.
our new
Well,
item to
yeah,
add to the bundle.
We only know what we are
See, that one was,
Right.
notified about.
that particular instance was where somebody signed to release the insurance on the building. There wasn't a certificate of completion at the time. That's kind of where that one happened, and I didn't find out about it until after the
It was
day.
in anticipation of certificate of completion, and unfortunately, we had it executed on behalf of the county that we were agreeing to their terminating their insurance liability. That's where that 3-week gap came in.
And it brought up,
So-
what I've been told is when we have a large reinsurance group like this, where we have all of our buildings, that we have I think it's so long to add those buildings anyway, is what I was told, but we still had the concern because the sheet signed saying it was being released, I think about 30 or 45 days earlier.
September 17th or something like
Yeah.
that.
I'm sorry, I think we blindsided you with this issue.
But I'll tell you, the day that I am informed that we have acquired a new property, the insurance company is informed.
So they're informed,
And then we get it added
so-
to the schedule.
so you informed the provider of our insurance or you informed our
I
consultants?
inform, well,
They do all
first
that.
and foremost, I inform the insurance company or our broker, whoever. And then it gets
Bob
The
and them-
insurance company will
Jeremy
not
that he-
notify us.
He's got to calculate the value.
We're
Jeremy,
not
or something.
insured.
Yeah.
Our
Right.
company is not.
Yeah.
Right.
So we have to receive, it'd be
Yeah.
good if we got like a copy.
Well, that's why I want to bring up this process. I want to see, because I don't
Right.
completely understand, and I've heard different
Bob
things
works on
about a
that.
gap and a rush to pay, and I want to make sure that the process is, and we can, how about this, we, next time we meet, or in the meantime, procedure listing of how new properties get on. And if we need to add to contact our consultants into that process, if they're not currently in it, we'll make sure they're in the loop.
And if you'd like, we'll bring our director that handles that at the next meeting.
We don't have anything big coming on anytime, I hope, in the future, but
I mean, if you had questions, because he deals with it every day. I
Yeah.
don't.
I just keep hearing, and I don't know, I just keep hearing about the gap and how we had to rush to make payment. And I just want to make sure the whole process is.
As far as I know, that's the only time that's ever happened, that I've
Yeah.
seen that.
And-
There's, basically, the builder came and asked them to sign off on a release for the insurance. Retroactive about 30 days before the signature date. They didn't find out about it until after it was signed a few days to notify the insurance. Talking to the carrier, they say that you have so long to add, but still the same thing, I'm just like legal here, I'm very cautious to have something saying that we released insurance before we pick up additional insurance. Well, the other thing it brings into play is that Bob has to have time to send Jeremy out to get an estimate for the building to
That's what I'm
actually
wondering.
add it on to the, so we really need to have, right before they're released, Bob to be able to send a person out to get an estimate for it. That's kind of,
Did you get sent out to our new courthouse for an estimate?
after we bought the
Yes.
insurance.
Has it been out?
Yes, yes.
Kim would know.
Kim works
Yes.
with Jeremy,
Yeah,
who
she would
is.
notify Jeremy.
We-
Jeremy has done the full assessment of the
I
The
can-
procedure was followed correctly. The problem was the release. That was what was out of character with the whole arrangement.
And how we handled that was we came up with a value that we were pretty much assured
Yeah.
would cover the building based on what
Yeah, we
Jeremy's
over-
understanding.
yeah.
We over-insured it until Jeremy had a chance to find out what the value was.
And we left it at that value that we,
But I think it was like
it was just like maybe
Yeah.
4 million more. or
more,
something
so
like
we
that.
basically, something we felt sure that it would be more than enough to cover, so we're about over-insured on that building, about $4 million right now.
Another thing, this gets technical, but briefly what I want to tell you is, I mentioned there's a difference in what you sell a location for and what you build it for. There's also an insurance difference between as-built and what it would take to replace it.
Yeah,
Biggest thing is, you're not insuring the land, which is you had to purchase the land to build it there. Well, we don't need to insure the land for it to burn up, or it's not gonna burn up. So, and some of the foundation work, and all of that stuff, you're not gonna have to replace, so why insure it? So your insurable value could be off a little bit from as-built. We've had boards come up and say, well, no, wait a minute, we paid this much money for this school. We said, could you send us a detailed list of what that includes? And they do, and we go through and say, these are not things you insure, and this is how this works. So it's a bit complicated, but, and we get updates to those values through this software monthly by zip code. So it keeps up with labor costs, material costs, and all kinds of lumber, steel, all that stuff.
It sounds like you do a very thorough job. Thank you.
We wouldn't have it any other way.
If you could just send us the current procedure, and so that we know what's going on, I think that would be helpful for us.
One thing to clarity, when we talk about self-insurance, we are not self-insured on buildings.
Got that?
We're fully insured. We are self-insured on the job injury and on health and on dental, but not for buildings. And then liability, we have insurance for, we have, I guess, excess risk on liability is the best way to put it.
And in commercial insurance, there are different ways. It's not like you insuring your house where you have a $500 deductible. It's not like that. When you have millions and millions of dollars of property, there's a thing called a self-insured risk, retention. So in other words, there's like a big number, like $100,000 or something, and then it kicks in. It's kind of an umbrella up here. It's a little complicated, but it's industry-wide. This is very common practice.
Question for clarification. Do you still want us to send a list of buildings, or did you want to just get that through Kim, or how do we want to do that?
I mean, I have Jeremy's.
All the
most recent
reports,
list.
all the things that we do.
Yes, and what we do every year, I
Yeah.
break it out into departments
Mhm.
when it's time to to redo the applications, and I send it to each department to make sure that they don't have any changes or updates or corrections, or, so that's how we
Excellent,
move forward with that every year.
yeah.
And I've looked at
No,
it with you before.
I think
too,
Kim
because
can
I
take
know
care
I
of just
don't-
distributing the most current list.
Okay.
There wasn't
All
insured
right.
at one point.
You're good with that?
Yeah.
All right, thank
Okay.
you. Thank you for
We'll
your
get the
report.
list.
Yeah, if you have any questions,
Yeah.
call us,
All right.
or we'll have him
Thank
come
you.
up and meet with someone or whatever.
Most important lesson we always find with buildings is the issue is that people don't tell us something was built. That's often more schools, not you guys, because you don't build quite as frequently, but just bad information, yeah, which,
We've had multi-million-dollar athletic facilities that were not insured for 2-3
Yeah.
years.
that's why we
Because
go.
the booster club built it.
Yep.
And somebody thought the other person reported it and nobody reported it. So our people go out and look at their list and say, that really big building is not on this list. So everything stopped and a bunch of phone calls were made and
Get it taken care of. Thank you. All right, thank you for your report.
Kim, what's your last?
1-to-1?
I'm Kelly Ballinger. I'm the practice manager for the Sumner County Health Clinics for the employees and their dependents. So I think everybody got one. I'm not really sure, but these are the reports that we have. This is all for 2020-30. The top section shows you the clinic usage. Does everybody have one? I have more.
I think we need one or two more.
Okay.
This one's, oh, yeah, here.
Thank you, ma'am.
You're welcome.
So it shows your top clinic site usage. The Schaefer Clinic is obviously one of the busier clinics when it comes to the Sumner County government and their families. And then the next is the top clinic visits, walk-ins, sick visits, med refills, and currently the health coaching and behavioral health have been some of our top for 2023. The next section is our patient satisfaction survey results. So Q1, 99, Q2, 97, Q3, 98%, and Q4 was 97%. Just stop me if you have any questions.
Is the virtual the text care?
No.
Okay.
So, text care did not go into effect until November.
Okay.
So it doesn't really show these. I think, I'd have to look back at our quarterly that was sent, but. I can-
Okay, so will it ever be added?
It
to
will.
this?
Oh,
Okay,
yes,
perfect.
yes, yes, yes.
Okay.
I have a question.
Yes, sir.
Yeah, versus going.
I go back to a time when we were at the old utility district
Yes.
building and then had just moved to Schaefer. When did all of these other clinics come about?
So 1-to-1 took over in 2017. So the Portland Clinic, the Schaefer Clinic, Westmoreland and White House were all there. The Ellis Clinic came on probably 4 years ago when we were at it's on Dunn Street. What is that building called?
Which one?
The Dunn Street location where you can,
That's the old
is it, okay.
utility
So over there,
district.
and then we moved into Ellis Middle School when they realized that there was a whole section for us, a lot bigger.
At one point you had a hunt club, but it.
Oh, we did have Hunt Club,
It
and then
got
we
shut
combined
down.
those two.
It got shut because of the cost of the rent was very expensive.
And this is what I was getting at. And first of all, I guess I need to ask, are you a private organization we contract with?
Yes.
Or, okay.
Yes, sir.
And what is your, what's your corporate?
1-to-1 Health.
Okay. And when did you start working for the county?
We came on with the county and the Board of Education in 2017.
And now it's just the county?
We do both.
Yeah.
So these numbers that you see right here are just the government. This is not any of the Board of Education's numbers.
Yeah, it's our cost plus the cost share on some of the other items.
Pardon?
It's based on the cost of our visits, plus some items have a percentage of a cost share is how we get billed. Us and the board divide the cost.
And how
So why should we be doing the board?
We do participation, in other words, they pay for their cost of their visits, we pay for the cost of our visits, and then we have I think it's a contracted percentage on a few items.
So let me ask you for clarification on where we're at here. When I look at the first chart and I see a year-to-date total of 4,857, that is just county employees and not Board of Education employees. What is our percentage that we're sharing?
8614? I think it's
Could you-
8614.
I thought it was 8/17, but I could be wrong. Because it changed a couple of years back.
And for some reason, I'm not catching what you're saying. I'm sorry, can
In
you?
other words, we pay for certain items, it's ours directly, we pay for the cost or per visit. And then certain items, we have a percentage that's a breakdown based on what the utilization is on average.
And that's like the x-ray machine?
Yes, and it was based on the utilization between the two entities, and it was agreed upon probably maybe 2 years ago, would that be correct? Does that sound right, maybe two? Just from blank recollection, we've got the contracts upstairs.
And one point of clarification, the numbers, what you're paying them is actually also included on this sheet.
And I have it broke down on the financials,
So
I can
just,
check the cost.
just so you know, the total it's going into that same fund.
I think.
Under my report, I'll go through with what it's cost so far.
Because we're kind of like a piece of the partnership between the county now and the schools, because we have a bit of a divide in some areas, but here we're together. I think that for me, if I could see like our joint numbers, because I feel like if I wasn't participating, it would harm schools, and if it's back and forth. If I could see like the 4,000 is my county employee numbers, if I could see how much school uses it, so I could feel like, all together
yes.
we're in this together.
Absolutely.
If you could the next time you could show us
I can.
our total
What's the
partnership,
percentage?
because that's what we have, right? Is it just us? It's just the two entities, right? The county and the schools?
Correct.
Okay.
Pretty reasonable.
I think that's
If
right.
you'll give me just a second, I can tell you there what,
It's just so we see, like, we're in a partnership and we only see our side of it. And next time would be fine. We don't have to.
Well,
Okay.
they do
I can get that over to
If
you.
that's,
so let's just say, based on the clinic usage, just that one, Board of Education by itself did 23,616 clinic visits for the entire year.
so where our number is 4,000 some, theirs is 23 some.
But you have to think, they've got a lot more.
Oh, I know, they have
Okay.
a lot more employees. So when it comes to paying for the cost of the clinic, I understand what Mr. Long is saying, we pay for our actual usage. So I come in and they treat me and there's a clinic visit. But then there's the clinic, and I'll discuss the finances with him later. That's okay, I'm sorry, thank you.
We got contracts and bills if you want to see them, it's pretty easy.
Just asking, thank you.
Yeah, no, you're fine.
Okay, my next question is, who makes the determination as whether we should open another facility or not? Because that's certainly an expense, could be a major expense to the health program. Do you make it?
I do not. Obviously, it would be taken to the Board of Education, the government, to determine if it's needed.
To the Board of Education?
We would take it to both of them to say, for instance, I'll give you an example. We decided that if we were to install an x-ray machine at Ellis, would it be beneficial? So patients didn't have to go to Premier Radiology, they could come to us free of charge to do an x-ray. We take it to both of our groups and say, do you agree to this cost or this idea? And if they say yes, then we take it to the other one. If they say no, vice versa.
So to whom do you go on the board side?
To the benefits, so Earl Bushong, Amanda Brown, take it to them to decide. I don't know who they take it to after that, but.
Come to the government side.
You guys.
Us.
We do it.
See, there's two things. If it's something like that, it comes back to you guys to decide if you're willing to pay for it. Now, if it's like small day-to-day things such as how many flu vaccines they're gonna order, several years back, the board voted to basically give that to me.
Do they pay all of it?
Like which one?
The Board of Education?
No, if it's like, say, for instance, the x-ray machine, they'll come to you guys and the board. If you're in agreements, then they'll do it on that agreed split cost. So like the last x-ray machine, and I wish I knew the percentage right off, we paid the 1% and the Board of Education paid the rest of it to put the x-ray machine in. Which clinic is it, Ellis? It's not.
At Ellis.
Is it Ellis at Ellis? So that's how it's earned. If one of these don't agree to it, then it's just not bought unless the
Right.
other ones agree to pay all of
Yes.
it.
Right.
And that is one of the items that I wanted to highlight, in that decision on the x-ray machine was made by Commissioner Brown and myself. And I felt like that it needed to go from this board on up through budget so that everyone is aware that we're making appropriations.
But
Even though at that point it was low.
But
not-
this is what you've got. Budget and the commission by and large, they fund each year your insurance premiums based, they come in actuarials and the cost. This board by the commission was powered a long time ago to basically run this fund. It's a non-budgeted fund. It's a proprietary fund, so it runs just like a business. We can
Okay.
do all the assets and liabilities. So really, there's no appropriation involved, and that's why they set it up this way, because you guys would have more time to look at that stuff and study it based on the amount that you got available. Now, if the fund was not self-sufficient, then it would need to go to the, budget committee and definitely up to the county commission. Right now, you guys are covering your cost, and that's more of a management issue for your board. If you run it up through budget, then you're gonna create another layer and really slow down your fund and the budget committee to grow.
But to address Commissioner Hyde's inquiries, he didn't know we were growing clinics, and he didn't know that Bob and I had partnershiped with the schools in an x-ray machine. So,
They sent that out
So
to
the only
boards.
clinics, we only have 5 clinics still in Sumner County. The one that says like behavioral health and wellness, those are more of like your virtual, if you have a behavioral health team. They can run out of the Ellis Clinic, but those are just like behavioral health visits. Wellness is for your HRA events and items like that.
Care here, one-to-one setup very similar to Care here was when you were on the board with Mr. Hyde on the employee benefits back then. It's pretty close to the same setup. So I think they even had it set up the same back at that point, and we had the, Ms. Denner was the law director. If it was something like vaccines or something small and day-to-day that me or her was to deal with, if it was a normal operation of the clinic, something that they didn't, think was within their contract. If it was something that required monetary, then the board approved it. Now, the understanding was that the fund was to be self-sufficient, or it was to go back several years back to the budget committee and county commission, because at one point the fund did have issues on financing. But that's been the understanding, but there's not really appropriation of this because the county commission does appropriations for your actual premium, whereas they pay so much for a family employee plus one when they approve their original budget. So they say we're willing to fund this much for the employee, and they're willing to do that. So it's really back to the board. And I understand what Mr. Hyde's saying, they're not really aware of, but I don't know if you want to run all that through your committee, because it's really going to slow you guys down as far as budget and county commission to look at stuff like that.
I just don't want anything to be uncontrolled. My next question would be, who pays for all of the flu shots that the Board of Education gives free to employees?
But they do.
The Board of Education pays for them.
And it's no expense to us.
We pay
Two.
for hours only. They'll call me each year, and based on what we did last year, we will do the flu shots for people that are in our health insurance based on what we think they'll use. Because even if you're like one of our participants and you go to, I don't know, one of the walk-in clinics at the pharmacy, they'll cover your flu shots too. So the amount they're charging back to Blue Cross is actually more than what it costs to go to one-to-one. So we do based on the number of estimates and how many we think we can return if we don't use them.
Right.
And that's what we do each year. And during COVID, for instance, we had a lot of excess. So the next year, I had you guys to really ramp down the number of flu shots because everybody quit taking flu shots basically because of the COVID shot, or what, 30% of them did probably. We lost about a third of them, I think. But yeah, they pay their own, and we pay our own on things that can be identified.
What
If I may, I think without sacrificing the efficiency and speed of this board, I think just to be notified of what's going on, this could simply be a commission report from the SIB of what's been going on, and I think at least you'll be updated, but you won't interfere with 2 months layers worth of committees and commission decisions, and we can move it quicker.
that's what I was coming to the same
Standing committee,
yeah.
a standing committee on the commission report agenda.
what would happen
And the chair.
if this board said, okay, we don't feel like this White House clinic is seeing enough patience and we want to close it, and the Board of Education says, no, we want to keep it open, what would happen?
We would keep it open for the Board of Education. As far as the price drop for what the county is, I don't know what that would be, but I can ask that,
Okay,
absolutely.
please add that.
So our White House Clinic is only open 2 days a week, Tuesdays and Fridays, and Westmoreland's only open 3 days a week, Monday, Wednesday, and Friday. So that's kind of, but, I mean,
What is your contract cost to operate this program?
I can get that.
Hey, Mr. Hyde, we can bring a copy of the contract for the next meeting. Would you like us to do
Yes,
that?
and how long is that contract?
I can't recall off the top of our head, it was renewed. I'm guessing it has a year or two left on it. We'll have to find out. I could be very far off
Not
on that.
that
Time
I'm
flies by. so-
dissatisfied, I just want to know.
Oh, yeah.
I think we can bring, I think Amy, you probably got copies. If not, we can get additional. We can get them out of our archives and bring the last signed copies back to the committee.
Just a question.
Would you like Amy to email them to you
said
guys before the meeting?
Please.
Monday, Wednesday, Friday, and
White House is Tuesdays and Fridays.
Fridays, okay.
Bob, we'll go ahead and email the committee copies of all the contracts, that way you guys can look at it before the meeting too, make it easier for you.
Madam Chairman,
Yes, sir.
if everyone's through, could I ask a question, please?
Let me, 1-to-1? Are you finished with your report?
Actually,
It's
has
to
to do
her,
with her.
okay. Yes, sir.
okay, this is actually a property question. It was my understanding quite a while back that all of the fixtures and everything that 1-to-1 uses in the clinics is owned by the county,
Correct.
right? I don't know, if everybody know that?
So, not by the Board of Education, but by the county?
Well, I'm talking about globally.
It
In
belongs to
other words,
the,
1-to-1 does not own it.
Right, it's not ours. So if the contract was in, we would just basically pick up ourselves and leave.
Now, this also includes meds, right?
Correct.
Although you all can't do anything with them, you're not legally able to do that. You'd have to hire them to do something, or you may have a thing to buy them back, or, so I'm not sure. My point of asking the question is, some may think it's insignificant, but nothing is in our computer. Are we anticipating that that's covered and it's being reported as medical equipment and so forth on the content side, not the building side? And for two reasons. One is the drugs, and secondly, now that you're talking about x-ray equipment, that's not cheap stuff, and fixtures have to be adapted for that and so forth.
they're all in schools, so the schools would probably need to be the one insuring that, but that's a good question.
Well, right, we don't work for the schools, so I
Yes.
just want to make sure the county isn't surprised when
Yeah.
a tornado takes out the clinic with an x-ray machine in it, and it's like, it costs what?
Right.
And we're not covered for
So-
that.
They're all in schools, so
Is-
we don't control the
Would
school
that be
insurance.
something that, I feel like it's a little bit more of an ask for 1-to-1 to ask the schools about their insurance.
I
Is
can get
that
with the-
something that we can do?
I
Yeah,
can
from
get
the
with
law
Board of
office?
Education on that.
Yeah, I mean, it's schools, but schools operate off of
Mhm.
county taxes, so,
Yeah, but there is a big wall between us.
yeah. I know.
We do too.
All
Uh,
or forced fees.
I do have another odd question, since you're bringing up the x-ray machine, and it doesn't have to do to 1-to-1, but I don't want to stop you. Our tourism board has a dock on the lake. Do we insure that?
I'd have to look, I'd need an address or at least
I think
a
that's on there.
possible location.
Came up last night,
How did they acquire the dock on the lake?
We have a what?
the dock.
How did they acquire the dock on the lake as a component of the county?
They said at first that the Corps of Engineers owned it, and then it was made clear to them that the Corps of Engineers doesn't own any docks, and they said, well, we just maintain it. And we said, well, what
Us
about the
insurance is kind of
insurance?
questionable because they're a separate legal entity and a component unit, a standalone. The county should not be insuring their property, but they should be. I mean, that's a good question. I mean, why would the county insure their dock anyway?
Can you put that on the legal follow-up?
Your tourism's their own
Where's the
entity,
dog
they're
at?
legal, standalone.
Where's the dog at?
I must think they said Bull
How do they
Run,
acquire
but
the
maybe if you
dog?
could talk to the tourism board. I'll give you a member on their committee.
The county farm, how did they acquire the dock? They're staying in a building to be.
I'm sorry, the x-ray brought me back to the dock being another oddity.
Acquired the dock.
Yeah.
These are things we run into, tracks around football fields, people just assume things are covered, and by the way, those things are really expensive. And so, but on that, we'd have to work it in, but if you can get us a location, we can go out there.
And Kim will follow through and we'll let you know, so. I'm sorry to interrupt your report.
No, it's okay.
It was
It's
just
okay.
like,
We can give
It's
you
the
a
first
number.
time.
Go to it,
Together.
yeah.
I'm confused where they got that from.
And then you have the wellness numbers at the bottom, and this is currently what we're in the process of doing the health coaching for. So the physicals had to be completed by September the 30th. There are 689 accounts. Obviously, every month that changes because people fall off of that. So I think today it may be less because this is based on last Monday's numbers. Health coaching has to be completed by March 29th. Those 577 had either completed coaching or were already compliant and did not need any coaching. The nicotine benchmark, they have till March 8th to retest. So they will retest, and if they retest negative, then they'll become compliant. So 612 have either met benchmark and were already nicotine negative or have retested negative. And then we are at 50% of coaching, so 25 are halfway to become compliant.
since we have contracted with you in 2017, how many of our employees have you coached off of cigarettes?
Good question. I can get that to you.
Okay. Thank you.
Yes.
Do you have a total of the clientele?
A total of
The clientele?
For
number of people that
the
you see?
government?
Yeah.
Oh, I can look at our actual eligibility of that we're saying every month, and I can give that to you before the meeting's over. The next page is just showing the Sumner County, the wellness. So the start date, the HRA event dates, and the health coaching, and then what the benchmarks are.
Bob, they have to report that to us annually, because if you're non-compliant, then you go to the non-preferred health plan, so we get a list of that every year. If
We'll
it's-
figure out what kind
We
of
get it, I
percentage.
believe, is it March?
I get it in
April.
April,
April, I'm
because they
sorry.
have until the end of March.
Right, so we get it in April because we've got to report it to Blue Cross effective July 1.
Yeah.
So we'll know in April who's compliant and not, and who else the group is.
And the next one is just for the reminder of the x-rays that we are now offering at Ellis. And then I've got flyers, if you guys want to take them to your departments, basically for the text care. Do not let people forget the text care, because it is fantastic. Okay. Any questions? Yes.
I've got a personal question.
Okay.
So just to cue us up, I think that we're almost to the end of our one-to-one report out. We'll find out in a moment. The next section we're going to have is an executive session, and that is where we're going to ask everyone to leave the room, and we're going to go over the liability for injuries and such, and then we will reconvene. I am, because of the combining, I'm not sure about the insurance equivalency and why is that you? So if you could,
Dee's way down here, I don't understand.
when we go into executive session, if you could step out and then prepare to come back in. I don't think it'll take long.
Okay. Not a problem.
But we'll make sure that she's finished.
Sounds good.
So,
Send me a text or,
I'm saying
did
it's
anybody
upstairs.
stop my meeting to have a personal
Yeah.
conversation?
Welcome.
hey, can you send me a text?
All right.
Well, what, this is
So,
right now.
does that conclude your one-to-one report?
That is it.
All right,
Thank
thank you
I
so
don't
much.
think it'll be
So at
finished
this
till
point,
about 5 p.m.
we're gonna go into executive session. So if everyone could just step out, it shouldn't take very long. We'll be going over some private information with the lawyer.
Yeah.
And then we'll, let y'all back in.
What, ex officio?
So I need to study minutes out.